My name is Stacey McBryde, and I'm so very happy to present this funding proposal to you today. I'll start with a brief overview of the 12th Street Health and Wellness Center. Then I will outline a few of the issues surrounding health literacy and its relationship to medication adherence. This will lead us to our proposed project and finally the amount of funds needed to complete the project. The 12th Street Health and Wellness Center is a student-led, interprofessional center which provides services from the University of Arkansas for Medical Sciences, colleges of health professions, medicine, nursing, pharmacy, public health, and the graduate school. The center provides information for healthy living, preventative care, consultations and screenings for chronic health conditions. Under the supervision of licensed healthcare professionals, UAMS students provide health and wellness services, including disease and medication management, basic dental screenings, health screenings, education, and immunizations for the community. The center has also recently added a children's reading corner. Since the 12th Street Health and Wellness Center opened, it's been obvious that medication management is an area where pharmacy students can lend a hand to the community. When it comes to taking medicines for chronic conditions as prescribed, Americans earn only a C+ on average, and 1 in 7 receive a failing grade, according to the first National Report Card on Medication Adherence, recently released last month by the National Community Pharmacists Association. According to the report, millions of adults aged 40 years and older with chronic conditions are departing from physicians' instructions in taking their medications by skipping, missing, or forgetting whether they've taken doses, failing to fill or refill prescriptions, under or overdosing, or taking medication prescribed for a different condition or even for a different person. Part of the reason is low health literacy. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. It is estimated that 80 million U.S. adults have limited health literacy, with 21% of adults having basic health literacy and 14% with skills below an acceptable level. Low health literacy is associated with increased hospitalizations and emergency care, decreased preventative screenings, and a higher susceptibility to chronic illness and higher mortality. A cross-sectional study found that although 71% of patients with low literacy correctly stated the instructions, take 2 tablets by mouth twice daily, only 35% could demonstrate the number of pills to be taken daily. The study also found that taking a greater number of prescription medications was also significantly associated with misunderstanding. So why am I telling you this? We are seeking Blue and You Foundation funding for a newly proposed program called the 12th Street Health and Wellness Center Medication Reconciliation Project. The goal of this project is to provide multiple opportunities for pharmacy students to utilize the teach-back method while they assist their vulnerable populations with medication reconciliation. This will benefit both the students and the patients at the center. The teach-back method is a health literacy intervention that has had documented success in assessing understanding, but more than that, it addresses the need for clear communication. In fact, the National Quality Forum identified teaching back as one of the 50 essential safe practices to improve healthcare. In the teach-back method, providers ask open-ended questions to encourage the patient to restate the medical instructions in his or her own words in a feedback cycle that includes instruction, assessment of the patient's understanding, and clarification if needed, until the patient fully understands the provider's instructions. Studies have shown that patients participating in the teach-back method have better recall and understanding of procedures and may follow treatment plans more carefully. The Medication Reconciliation Project will use a social marketing approach to identify the most effective strategies and materials for equipping pharmacy students to use the teach-back method. In this approach, the project will conduct additional research to understand pharmacy students and patients' perceptions of patient-provider communication and medication reconciliation. Research results will be used to develop a strategic marketing plan to guide development of training protocols, teach-back reference materials or scripts, special low literacy materials to reinforce consulting efforts, and promotional materials and activities. The requested funds for this project will be used to support one part-time project manager and the production of the project materials such as posters, flyers, medication list, medication bags, and patient incentives. A detailed budget of line items will be given later in this presentation. The first phase of our work will be to observe the pharmacy students as they are trained on the teach-back method and as they practice it in the simulation lab at UAMS. The teach-back training and simulation lab experience are already included in their college curriculum. The project coordinator will work with the College of Pharmacy instructors to assure the fidelity of the teach-back training, to ensure all students receive the same level of training and have approximately the same level of knowledge and skill. We will follow up the observation period with exit interviews to identify the students' attitudes, likes and dislikes, and general feelings regarding their ability to use the teach-back method. A protocol guide will be developed to guide these encounters. This information will guide the development of survey questions as well as to establish a baseline measurement of health literacy knowledge. We will then develop pre- and post-test surveys to answer our formative research objectives. One survey will be administered to the pharmacy students and one survey will be given to the patients of the center prior to implementing the project. The same survey will be given again at the end of the project. Based on the survey results and a thorough review of secondary data, a comprehensive social marketing strategy will be developed that promotes the use of the teach-back method during medication reconciliation encounters at the center. We will select and design the medication reconciliation project materials and activities that resonate best with our target populations. We will pre-test the materials with a convenient sample of patients at the center to ensure that they are useful, easily understood, persuasive, and culturally acceptable for our target audiences. We will obtain prototypes of the selected tools for evaluation and feedback as needed, and we will exclude prototypes that are beyond the financial resources available. Additionally, we will brand the products with a slogan or logo to generate brand identity and market the tools. We will foster existing community partnerships to develop strategies to promote the Medication Reconciliation Project, as well as build on the ongoing outreach activities of our community-based partners to target low health literate populations and augment any planned activities specific to health, such as church health fairs. We will conduct a student and staff training at the 12th Street Health and Wellness Center to administer the pharmacy student survey, then introduce them to the Medication Reconciliation Project, including the proposed protocol and script. The Medication Reconciliation Project will encourage the patients of the 12th Street Health and Wellness Center to gather up all their prescription and over-the-counter medicines and bring them with them for pharmacist review. The goals of the project are 1. Promoting better patient-pharmacist communications, 2. Identifying and solving compliance problems, and 3. Spotting duplicate, outdated, and poorly stored medicines. The project coordinator will register patients in advance to give them their medication reconciliation bag to bring back with them filled with all their medications. Simple instructions will be given to the patient along with the bag. Additionally, the providers will emphasize and encourage the use of the medication bag. The project coordinator will telephone registered participants the day before their appointment to help prevent no-shows and to remind them to bring back their medications in the original containers. We will have patient education materials on hand for distribution to patients during their appointment. Upon launching the intervention, we will monitor the progress and make any adjustments as necessary to improve the program's impact. We will conduct process evaluations quarterly, as well as an outcome evaluation of the effectiveness of the project at its conclusion. Based on the results of the project, key interventions and strategies will be identified for continuation and replication with future pharmacy students matriculating through the 12th Street Health and Wellness Center. We will share the results of the project with the leadership at UAMS College of Pharmacy and other health professional programs, as well as with the 12th Street corridor community. Additionally, we will seek to expand the project to include the UAMS Colleges of Health Professions, Medicine, Nursing, Public Health, and the Graduate School in the future. We understand that health literacy principles and provider-patient collaboration are important lessons for all health professionals. Our anticipated budget is as follows: $20,000 for a part-time project coordinator with an additional $5,000 for benefits, $156.84 for the medication reconciliation list, $86.28 for the campaign flyers, $530.16 for the medication bags, $372 for the medication reminder magnets, $25 for the campaign posters, and $500 for office supplies, internal printing, and unforeseen or miscellaneous expenses, for a total of $26,670.28. Thank you for the opportunity to present this funding proposal to you. Feel free to contact me with any questions or comments.